Again, our top story, health officials are looking into possible loopholes in the distribution of free ivermectin and prescriptions of the anti-parasitic drug in Quezon City yesterday. The health department says it will ask the Professional Regulation Commission to look into the release of prescriptions that were reported to have been haphazardly done. The agency also asking those who receive the drug and prescription to call their PRC, the PRC, or the Food and Drug Administration for any adverse reaction. We now go above and beyond the headlines with one of the doctors who gave away those prescriptions yesterday, Dr. Iggy Agbayani. Dr. Agbayani, thank you very much for joining us this evening. So can we clarify po right away, the reason kung bakit, isa sa mga dahilan kung bakit napaka-controversial yung nangyari kahapon sa Quezon City is because of the prescriptions on yung sinasabing bond paper lang, tapos walang pangalan ng doktor, walang professional license number, at walang ibang mga detalye. Pero kayo po, Doc Agbayani, you issued prescriptions upon seeing the patients, and you did put your name, your license number, etc.
Yes po, Pia, thank you for inviting me here. First of all, we prescribe ivermectin, and it's controversial because, as you know, FDA has been saying it is not a registered drug, but we can actually prescribe off-label, and this came from the FDA itself. So there's nothing wrong with prescribing off-label, but of course, they say unregistered drugs should not be given. However, we prescribe dun po sa lugar na yun, ang meron kami, yung tinatawag na compounded ivermectin. So that is legal. So I think they're just looking for loopholes just to try to harass us and things like that. Let's say, for example, they want to complain to the PRC. Did you know that one of the doctors there is part of the PRC board?
Mm-hmm. Okay, who is this doctor?
Dr. Rafael Castillo is part of the board. So are you telling me that you're going to complain to him after he forgot to write his name? So I also forgot to write ivermectin, and the reason for that, sa dami po ng reseta na bigay ko, akala ko nalagay ko na yung ivermectin. But I wrote there he is. That's Dr. Rafi Castillo. He's part of the PRC board. There's Alan Landrito over there. So there are only 4 doctors. So you couldn't probably make a mistake in terms of identifying doctors. So I think this is nitpicking. Mm-hmm. If you have nothing to say bad anymore, you can't defend your position that ivermectin is a controversial drug na lang. Sasabihin niyo, we know it works, it's safe, and they will just find loopholes in our prescription. Yung pangalan na lang about using bond paper. I mean, my father, when he was at home, a poor patient comes to his house, wala siyang prescription pad, he'd get a bond paper, write his name, prescribe to a patient, because his duty comes first.
Mm-hmm. Okay. Dr. Iggy, before we go any further, can you tell us first, just to make just to be clear about definitions, can you define for us when you say, a while ago you said we can we can prescribe off-label and then compounded ivermectin. Can you please define that first?
Yeah po, ma'am. Compounded drug is hindi po siya manufactured wholesale or in large numbers. Compounded drug is you have a prescription, you show it to a pharmacist, and then they will provide you with the drug. So parang siya, more personal in a sense. Unlike yung you can buy for your whole family, something like that. So iba po yung compounding. So the FDA allows that. And as the other question again?
Yeah, can you define muna yung off-label na sinasabi ninyo?
Oh yeah, off-label. Okay. Off-label is, for example, ivermectin being a drug that was approved for anti-parasitic. We will be using it for another disease, for example, COVID-19. Now, it is allowed as long as wala naman nagsasabi sa law that you cannot prescribe a certain drug versus a certain disease. So that was made clear about 2 weeks ago by the FDA itself. They said that off-label prescription is allowed. So I don't know what the fuss is all about. Ang basa ko na lang po rito, kung talo ka na sa debate, sabihin mo na lang, malaki mata mo. Ganun na lang ito. Loophole looking na lang ito.
Okay.
It's embarrassing.
Dr.
I think it's
Agbayani,
embarrassing.
Yes, you said, okay. You said a while ago, we know it works, we know it's safe. However, palaging lumulutang sinasabi nga ng authorities, the clinical trials do not prove that it did help reduce the symptoms of and I'm sorry, those are not the exact words, no? Pero in other words, in so many words, hindi siya naman talaga nakaka-cure, no, ng COVID-19. There is no clinical trial that will prove that at this point in time. And then when you talk
That's
about safety, of course, the first thing people think about is that, okay, so it's not, it wasn't meant for human beings, but they are being used for human beings now. Can you clarify that? And then I need to go on to the next
Yeah,
question.
sure, sure. Of course, it's for human beings. 3.7 billion doses have been given to humans over the past 35 years. It's been monitored by the WHO in terms of safety and considered one of the highest safety profile drugs in the world. Ganun po ka-safe yan. Of 3.8 billion doses given, only 4,666 adverse events have been reported to the WHO. So it's so amazing that they would actually try to claim that this is not a safe drug. Now, the question of efficacy is the issue. They keep saying po na wala raw po, kulang po yung study, ongoing. Now, they probably haven't checked actually the number of studies that's been done. And I will tell you now, there are now over 27 randomized controlled trials. Even the Department of Science and Technology said there's enough studies. This was what they said 3 weeks ago. Adding more is good, but it doesn't mean you have to wait for this study in the Philippines to be done. And they say na ongoing pa raw po. No, it's
Saying,
not
Dr.
true.
Agbayani, is that,
There are
oh,
24. There are
oh.
24
Pero ang sinasabi
peer-reviewed
din po
studies
ninyo,
that show it works.
ang sinasabi din po ninyo, Dr. Agbayani, is that this is something that should not be taken by people, by COVID patients, or by people, no, who don't have COVID but use it as a prophylaxis or a
Yes,
preventive tool, unless it is prescribed by a doctor. So
as
hindi
well.
po pwedeng parang ano hindi siya biogesic or medicine for colds or cough, for example, na minsan hindi mo na kailangan doctor's prescription.
Well, in other countries, it's actually off over the counter. I think in Slovakia, in Czech Republic, it's over the counter, and I think also in Colombia, it's also over the counter. So that's how it's safe it is. Now we were there. There were doctors there.
Okay.
We discussed with them their problems. So I don't see any problem with us prescribing it.
Yeah. Oh, Dr. Agbayani, can I ask, are you an infectious disease specialist?
No, absolutely not. But I studied quite well. You know, if you're an orthopedic surgeon like me, you really have to study and prove your worth. So I actually work harder than most infectious disease doctors.
Ooh, you're gonna get a reaction from them by saying that. But okay, so you're saying orthopedic surgeon. How does it work, no, among doctors, for doctors? If you're not an ID expert, but and you are an orthopedic surgeon, is it all right? You are prescribing medicine for COVID-19 patients.
Oh, absolutely. You know, we all are general practitioners. So I could prescribe antibiotics, and even people who are not specialists, our DOH secretary is a pathologist, our FDA director is an ophthalmologist. So we could have many hats, so to speak. It's just a matter of studying it more. The science is the
Okay.
same. So
The Doctor, just one more question. Let's go back to the prescriptions yesterday that were issued by, I guess, no, some of your colleagues. Yung iba daw tinakpan yung pangalan ng gamot. Meron bang ganun nangyari? At why would someone do that?
no. Actually, I made a mistake. I already mentioned that I just forgot to write down the ivermectin because I was concentrating on the dose. Because at that particular patient, she was a little overweight, so I had to double the dose. So I simply just forgot to write but it wasn't a problem because just 15 meters away, there's only one medication they're giving. So I don't see any problem with giving the prescription.
Okay.
And then wala naman silang ibang gamot. Di naman yung parang pharmacy that they have a choice. So it's an honest mistake, and
Okay. But that happened,
I accept
doctor,
that.
for okay. Oh, so it happened for only one prescription. Hindi naman lahat ng prescription na binigay ninyo.
Yeah, talagang ano po, nitpicking na eh.
Okay. Doctor, as some people have said in my last question, some people have said that one of the reasons why some people are willing to take ivermectin is because there's no cure right now for COVID-19. At the same time, some people may be feeling desperate at this time, even paranoid, very paranoid, no? Is that what is happening now? So, para bang willing na lang ang tao na to take medicine that isn't, well, okay, I'm not trying to get into an argument or a debate about whether it really is safe, etc., efficacy. But ganun na ba nangyayari ngayon? Sa sobrang takot na ng mga tao, they're willing to take anything. But kumbaga, there's a term, no? Take life na lang.
Well, we are in an emergency situation. We have approved a vaccine that has very little studies yet because we are in an emergency situation. So now, ivermectin is not a new drug. It's an old drug with a high safety profile. And now, before I even recommended it, I studied it well. I'm not one of those doctors who just saw one patient get better. No. Like I mentioned, I've read all 27 randomized controlled trials that prove ivermectin works as prophylaxis and as early treatment.
Okay. And very quickly now, doctor, how many patients have you given this drug to eat before the
Yeah.
ivermectin pantry kahapon na? And
Apo,
have they come back to you to say na okay na ako, doc, or yung iba may namatay ba sa prescriban mo, or hindi sila gumaling, or what happened to them?
Apo, right now, I think before the Matandang Balara event, I probably treated around 300 plus patients already. And I have often done them by tawag natin yung video conferencing or calling. So number one, they have my number. And number two, sometimes I would have to write down the exact drugs there. So it's very clear. So very few doctors actually give their cell phone numbers, and I do. And I put it there in my prescription in at least one of the patients. And I think they showed it in one of the videos where I put my cell phone number. How many doctors give their cell phone numbers?
Okay. Pero kamusta yung mga pasyente na prescriban nyo ng ivermectin before?
Well, so far so good. But 300 is a small number, so I have to say 100% so far. And some of them, not most of them, but around 10 of them were really hospitalized and they were able to recover.
So 100% meaning 100% gumaling?
Yes po. Kaya lang
And were
po,
they taking any
I do
other
not use that.
medicine?
Yeah. Kasi nga po, I don't believe in yung anecdotal eh. I always trust the science.
All right, okay. Sige, Dr. Iggy Agbayani, thank you very much for your time. I wish we had more time. We'll get back to you very soon. Salamat po, Dr. Agbayani. Coming up